presentation will be by Grace Law from North Carolina, and she's going to talk to us about COPD.
My judges ready? Asthma is killing me today. I mean, I can't breathe. Is there anybody else in this room who has asthma or may know someone with asthma? Well, did you know that horses can get something very similar to asthma as well? Hi, my name is Grace Law. I am 14 years old, and I'm from Picadillos County Kicking Tails 4-H Club, located in North Carolina. And I'm here today to talk to you about chronic obstructive pulmonary disease, or COPD, in horses. So a few of the things that I would like to go over with you in my presentation today are: what exactly is COPD? What causes this disease? What are the symptoms and how can you diagnose COPD? What are a few management options? And how exactly will your horse's quality of life be affected by COPD? So first of all, what exactly is this disease? Well, this is an allergic disease of the lung that is also known as HEAVS, or recurrent airway obstruction. And as stated, it's very similar to asthma in humans. So, for some basic anatomy of your horse's respiratory system, unlike other mammals, horses cannot breathe in and out through their mouth, only through their nose. So, when your horse inhales, the air will travel through the nasal cavity, down the trachea, and into your horse's lungs and small airways. So, what exactly causes COPD? Well, when your horse is exposed to poorly cured, moldy, or dusty feeds, this can be a cause of COPD. For example, if the judges would go ahead and pick up the bags of hay that I've given them, and if you choose, you can open up this bag to smell the hay. Now, good hay for your horse should smell very fresh and sweet, but this hay doesn't smell that way, does it? So this would be an example of a hay that you would definitely not want to feed your horse, because it could lead to the development of COPD. Another cause is when your horse is confined in a stable or a barn environment with inadequate ventilation. And these could be things such as low ceilings or hay lofts that cause the dust to accumulate closer to the ground, where your horse is more susceptible to inhaling those dust particles. Now, these trigger factors that I just explained to you can cause your horse's airways to become inflamed. For example, here we have a normal bronchial tube. And as you can see, it is very clear, and there's nothing constricting this airway, allowing for good airflow. However, here we have a constricted bronchial tube. And as you will notice, it is very inflamed, and there's a lot of mucus within this airway, which blocks the airflow and makes it very hard for your horse to breathe. I'm also going to demonstrate here with this model that I've made. The orange straw will represent your horse's trachea, the red balloon, your horse's lung, and the yellow on the bottom, your horse's diaphragm. So, when the diaphragm moves out, the lung inflates, as you can see here. However, a horse with COPD can have inflamed or blocked airways. So, I will represent this by pinching the straw. And now, as you can see, our lung no longer inflates. So, this just shows how blocked the airflow can become in a horse with COPD. Some symptoms that you may notice in a horse with this disease is chronic coughing, which could produce mucus, labored breathing at an elevated respiratory rate, increased abdominal movement at rest, which could cause your horse to develop a heave line, which is what this red arrow here is showing, flared nostrils while resting, wheezing, nasal discharge, exercise intolerance, and depression. Now, I'm also going to show you a video of a horse that actually has COPD. Now, as you can see in this horse, he has increased abdominal movement at rest, which is causing him to develop this heave line here. You can also see that this horse has flared nostrils at rest. So if you were to notice these signs in your horse, it's definitely something that you should be concerned about, and you should contact your vet immediately. Now, if the judges would go ahead and pick up these straws that I've given them, and go ahead and take a breath through your straw. It feels pretty normal, right? Okay, now go ahead and take a breath, but pinch it slightly first. You can get very little to no air in, correct? So this represents how a horse may feel trying to breathe with this disease. So your horse's diagnosis of COPD is based on their medical history and their clinical signs. When your vet comes out, he will perform a complete physical exam, paying very special attention to your horse's lungs and abdominal movement. He will also take your horse's temperature, pulse, and respiration, or TPR for short. Normal temperature rate is 99.5 to 101.5 degrees. The normal pulse rate is 36 to 42 beats per minute, and the normal respiration rate is 8 to 12 breaths per minute. However, a horse with COPD can develop up to 36 to 40 breaths per minute. So, to take your horse's respiratory rate, you will need a stethoscope and a timer. Then, you will put the end of the stethoscope in your horse's heart girth area. And you will listen to the number of breaths that your horse takes for 1 minute. Another way to diagnose COPD is through an endoscopy. This allows your vet to see inside your horse's airways to check for things such as inflammation or mucus. So when your vet comes out to do this procedure, he will use this tool here called an endoscope. And he will insert it through the nostril of your horse and into the trachea and bronchial tubes. Now, at the end of this endoscope is a camera that will depict an image very similar to the one shown here. In this case, this horse had excessive mucus in his trachea, which actually indicated that he had COPD. So now that you've diagnosed your horse with this disease, what are some ways to manage it? Well, one way to manage COPD is by soaking your horse's hay or feed. If the judges would again pick up the bags of hay that I have given them and take a look at the color of the water at the bottom of the bag. Notice how dark in color it is. This is because all of the dust particles that were once in the hay to the bottom and into the water. So now, when you give your horse this soaked hay, he is no longer susceptible to ingesting those particles. You may also consider steaming your horse's hay, and this is done in a hay steamer. One example would be hay game. And what this does is it literally steams your hay and removes all of the harmful mold spores or dust particles from it. You may also consider different stall bedding for your horse, such as rubber matting or shredded paper. However, if these items are not available, then usually shavings are less dusty than straw. You should also be sure that your horse has a very clean, cobweb-free environment with good ventilation, and you should turn your horse out as often as possible. You may also consider an equine cough syrup. This will be prescribed by your vet and administered orally to your horse. An example of an equine cough syrup is Vinton Coleman. Or you may even consider an over-the-counter medication, such as Respirafree, which is also administered orally to your horse. Or if your vet thinks that it is necessary, you may need to use a bronchodilator or an inhaler for your horse. And this works very similar to the way a human would use an inhaler for asthma. So what you would do is you would take your inhaler and place it over your horse's nose, inhale this substance within the inhaler, and that will dilate his airways, making it easier for him to breathe. However, if your horse's condition is very severe or he is unresponsive to some of these treatments, then it may be necessary for your vet to prescribe a series of corticosteroid tablets or injections. Now, within corticosteroids is a substance called cortisone, which helps decrease inflammation, therefore making it easier for your horse to breathe. One example of a corticosteroid in a tablet form is dexamethasone. So you're probably wondering, how exactly is my horse's quality of life going to be affected by COPD? Well, for example, my horse Jack developed this disease, and at first we thought that we weren't going to be able to ride him anymore. However, after having our vet come out a few times, we figured out that his trigger factor was hay and hot, humid weather. So, instead of hay, he now gets soaked alfalfa cubes, and he gets the corticosteroid dexamethasone. We we also turn him out as often as possible. And since then, he's gone on to do very well in several disciplines. So this just shows that even though a horse may have COPD, they can still go on to live a very long and productive life, given the proper care and management of their disease. In conclusion, COPD is an allergic disease of the lung that is caused by the exposure to poorly cured feeds or inadequate stable ventilation. This exposure can cause your horse's airways to become inflamed. Your horse's diagnosis is based on their medical history and their clinical signs. There are various management options to consider, including feeding, stabling, and various medications for your horse. And just remember, your horse can still go on to live a very long, successful life, given the proper care and management of their disease. My resources were my trainer, Laura Harper, this book called The Horse, and the Owner's Guide to Respiratory Problems in the Horse, Michigan State University College of Veterinary Medicine, Dr. Safia Baraksai, who's an equine respiratory veterinarian, and Dr. Puckett, who's also an equine veterinarian. Thank you, and do the judges have any questions?
I do. From your review, it seemed like all of the conditions that cause COPD in horses was environmental.
Correct.
So is there an age factor that you see that a horse would develop this more the older they get in the environment, or can younger horses also have COPD?
The question was, is there a specific age that horses are more prone to develop this disease? And no, a horse can develop this disease at any age. And from my personal experience, we noticed it in my horse at about age 8. However, it just depends on, as I said, the environment that your horse is in. If he does not have proper ventilation in his barn, or if he's eating moldy hay, that is definitely puts him more prone to developing this disease.
No genetic links.
I have come across a few genetic links in my research. However, there's not a lot of evidence to support this. The evidence that I have located is that if both parents have this disease, then their offspring can be more prone. However, there's not a lot of evidence to support this theory.
You compared COPD to asthma in humans. How does it compare to COPD in humans?
The question was, how does this disease compare to COPD in humans? And as I said, it's very similar to asthma in humans. However, there are not very many similarities to COPD other than, the breathing problems. However, it shares most similarities with the asthma in humans, with the wheezing and things like that, exercise intolerance.
You talked about steaming the hay.
Yes.
How long do you actually steam the hay? Is there an upper limit, say, on temperature of it? Or explain that process, please.
The question was, how long should you steam your hay, and are there any temperature limits on this? And what I came up in my research, specifically on hay gain, is that you steam it for approximately half an hour at about 200 degrees Fahrenheit, and this ensures that it removes all of the harmful substances within your hay before you give it to your horse.
And then to follow up on that, what is the shelf life of that steam hay?
The question was, what is the shelf life of the steamed hay? And you generally would want to give your horse the steamed hay immediately after you steam it, because if you do leave it in the environment that it was in prior to it being steamed for too long, it can go back just how it was. It could still develop more mold or get dusty and things like that. Any other questions?
Nice job.
Thank you.